We'll just give it a minute for people to join. Good morning, good afternoon, and good evening to all of you joining us from around the world. My name is Elizabeth Lule with ECDAN, and it's a great honor to welcome you all to this event on behalf of the Global Initiative to Support Parents partners that include UNICEF, WHO, the International Rescue Committee, Parenting for Lifelong Health, and ECDAN. Thank you for being with us for this important moment, the launch of UNICEF's Global Conceptual Framework for Universal Parenting Support. Today's event is about ensuring that every parent and caregiver everywhere has the support they need to give children the best possible start in life. And parenting is one of the most powerful determinants of children's health, learning, safety, and well-being. And yet, in many countries, it remains largely invisible in policy and under-resourced in practice. At a time of converging crises facing families and children, rising inequalities, and growing pressures on families, supporting parents is no longer a nice thing to have, but it's a systems priority. This new framework offers a shared global vision for parent support that is universal, rights-based, and firmly embedded in integrated systems. The new framework is a critical tool that will help governments, implementers, and advocates as they seek to design and scale parenting support systems and interventions. Developed by UNICEF in collaboration with the Parenting for Lifelong Health and with support from the Global Initiative to Support Parents Partners, otherwise known as GISP. This new framework is the result of contributions from a range of experts in the parenting field. And thank you and congratulations to all who contributed. This webinar is designed to be interactive, so we invite you to share questions, reflections, and country experiences through the chat and question and answer functions. Your insight will help shape how this framework is adapted, operationalized, and supported in different regions and contexts in the months and years ahead. And it is now my pleasure to invite Shima Sen Gupta, UNICEF's Director of Child Protection, to take us deeper into the vision and promise of this new framework. Over to you, Shima.
Thank you so much, Elizabeth. And I'd like to thank ECDAN on behalf of the Global Initiative to Support Parents for that very warm welcome, and also for your leadership in convening this important conversation. It is really such a pleasure to be part of such a strong alliance of partners who are committed to strengthening parenting support globally. Parenting is one of the most powerful drivers of children's rights, development, and protection across every sector in which UNICEF works. From early childhood development and education to health, nutrition, social protection, disability inclusion, mental health, and child protection, the quality of caregiving relationships shapes outcomes across the life course. Yet, too many caregivers are raising children without the support they need and often under extraordinary strain from poverty, from inequality, from conflict, displacement, and climate shocks. So this conceptual framework for universal parenting support was developed to respond to this reality and to reflect the full breadth of UNICEF's multi-sectoral mandate. Elizabeth mentioned it's not a framework for one program or one ministry. It is a system framework that's designed to help countries align policies, financing workforce, service delivery, and social norms around one shared goal: strengthening families so children can grow up safe, nurtured, and protected. I would also like to take a second to recognize the pioneering role of UNICEF's Europe and Central Asia Regional Office, whose parenting support framework for the early years laid the technical and conceptual foundations for this global version. Their leadership continues to shape progress across the region, from Tajikistan, where it has informed a national parenting framework, to Ukraine, where it has underpinned training for social service workforce. And I must say, having returned a couple of weeks ago from Ukraine, this is really impressive, especially that they continue to do it under the current circumstances. Like ECDAN, I also want to acknowledge the central importance of global partnerships, particularly of GISP. Through GISP, UNICEF and partners have worked together to elevate parenting as a global priority, connect evidence to policy, and advocate for universal parenting support that reaches all families, especially those facing the greatest risks. This framework also gives practical expression to UNICEF's commitments made at the Global Ministerial Conference on Ending Violence Against Children in Bogota. There, governments reaffirmed the importance of prevention and the need to focus upstream to address the drivers of violence before harm occurs. Parenting support sits at the heart of that prevention agenda. And this framework translates political commitment to guide concrete, implementable action across sectors and systems. Its relevance, however, goes beyond violence prevention. The framework supports progress across early childhood development, adolescent well-being, gender equality, disability inclusion, mental health, social protection, and humanitarian response. So quite a comprehensive model, actually. We are already seeing the use in practice. In Mexico, the development of a national parenting support policy has been guided by this framework, aligning evidence-based standards and tools with national priorities and cultural context through close collaboration with government and civil society. This process builds on many years of UNICEF-supported programming and shows how global guidance can be translated into national policy reform. So today's webinar also marks the first in a two-part series. On the 15th, we will come together again to launch a new policy analysis and benchmarking tool that will allow governments and partnerships to analyze and measure progress in policy development towards universal parenting support. We very much hope you will join us for that important next step as well. The real test in both of these resources will be in how they are used to support policy reform, inform national strategies, guide investment and financing, strengthen frontline workers across sectors. And it's important that we do it across sectors to ensure that support reaches families at every stage of the life course. As we look towards the Caregiver Forum in Madrid, we hope partners will see these resources not as an endpoint, but as an enabling tool for scaling universal parenting support across diverse contexts. So thank you for your continued partnership and commitment to translating the framework into real change for children and families worldwide. Thank you very much for listening and for being here, and really for action that is to come. And now let me hand you over to Christine Colby-Stewart to introduce the framework and today's speakers. Thanks so much.
Thank you, Shima, and thank you, Elizabeth, for those excellent framing remarks about the power of partnership in our goal to enable access to universal parenting support across the world. It's been a real pleasure to be involved in this work for UNICEF in collaboration with the Global Initiative to Support Parents and to see that partnership in action. So first, a few words about how we're going to structure today's session. We'll begin with a presentation of the framework by our brilliant partners, Dr. Jenny Doubt and Marta Rodriguez Plaza, representing Parenting for Lifelong Health, with whom UNICEF partnered to develop this framework. Jenny and Marta will present the framework and give us an overview of what the resource is. We'll then briefly hand over to two global experts, Dr. Amelie McCoy and Lulu Nkobo. Amelie works for the Peace Culture Foundation in Thailand, and Lulu is the Executive Director of Clowns Without Borders South Africa. So both Lulu and Amelie have got considerable experience in the design, implementation and assessment of parenting programs, and they're going to share with us their perspectives of the role that the parenting support framework can play at a national level. We'll then have the chance to open to some Q&A before we welcome Sabine Rakoto Malala from the World Health Organization to bring the session to a close. Before we get into all of that, I wanted to share a few words of background about what the parenting support framework is, how it evolved, and the role it plays in our shared goal of ensuring parents and caregivers are appropriately supported to raise their children. So, in brief, the framework attempts to set out a unified life course, multi-sectoral vision to strengthen parenting policies, systems and services worldwide. As Shima mentioned, it builds on the tremendous work of UNICEF's regional office in Europe and Central Asia, who last year, and the global framework really takes this work and expands on it to include a multi-sectoral life course approach with global applicability. And it was developed through a rigorous review of global and regional evidence, participatory consultations with technical experts and UNICEF regional offices worldwide, and careful alignment with other global parenting support initiatives to ensure coherence, inclusivity, and global applicability. Next slide, please. So why parenting support? So as Shima mentioned in her introduction, parenting is at the heart of children's development and rights. It profoundly shapes how children grow, learn, and relate to others. Research consistently shows that responsive caregiving support supports early brain development, social emotional skills, and lifelong learning outcomes. And children need care, nutrition, health, education, and safe spaces in order to thrive. Globally, we know that 4 in 10 children aged 2 to 4 lack enough responsive interaction or stimulation at home. And these practices are often underpinned by harmful social norms around caregiving. And children also need protection from violence. Today, about 2/3 of children experience violent discipline at home. That's roughly 1.6 billion children worldwide. And more than 1 in 4 caregivers believe that physical punishment is necessary to raise a child. So these figures really illustrate an important link that in order for every child to matter, every caregiver must matter too. Yet in many places, essential caregiver support is still out of reach. Next slide, please. And I guess it goes without saying, and it's a sad reality of today's world, that families almost everywhere are under growing pressure from conflict, migration, pandemics, and economic uncertainty. Existing caregiver support frequently remains fragmented across sectors and levels. And that's really why we think the time is right to accelerate global action to ensure every caregiver in every context has the support they need to give children the best possible start in life. And we now have strong global evidence on the effectiveness and cost efficiency of parenting interventions. This research shows us that parenting interventions reduce violence against children and intimate partner violence in the home, improve caregivers' mental health, and strengthen family relationships. And at the same time, digital innovation has created opportunities for scaling parenting programs at the population level, including the most marginalised families and those facing complex crises. Beyond individual outcomes, we also know that investing in supporting parents and caregivers generates wide-ranging social and economic benefits. Evidence shows that quality parenting support strengthens human capital through things like improved learning outcomes, higher lifetime earnings, and better health, whilst also reducing public expenditure in social services, justice, and healthcare. Parenting support, for that reason, is both a public good and a strategic investment in sustainable development, social cohesion, and the realisation of children's and caregivers' rights. Next slide, please. So the framework is underpinned by the Convention on the Rights of the Child, which called for assistance to parents and legal guardians in the performance of their child rearing responsibilities. This, taken together with the strength of the evidence about the impact of parenting support on children and on their families, resulted in UNICEF, WHO, and the UN Special Representative of the Secretary General on Violence Against Children calling for governments worldwide to provide and scale a minimum package of caregiver support. GISP and other global partners have been instrumental in accelerating global momentum for the provision of universal parenting support. And it's really this call that the Parenting Support Framework responds to by providing guidance for policymakers, ministries, local authorities, donors, civil society, and academic stakeholders to strengthen policies and systems for parenting support, grounded in rights, equity, and evidence. The goal is to guide the creation of comprehensive, coordinated, sustainable, and progressive parenting support systems worldwide. So this is really a milestone moment for the field, and we're delighted so many of you have joined us for the launch today. And with that, allow me to hand over to Marta, who's going to take us through the first part of the framework. Over to you, Marta.
Thanks, Christine. It's actually over to me. So as Christine and Shima and Elizabeth have said, the Global Parenting Support Framework is a conceptual guide. It brings together practical tools, resources, and country examples. It provides a structured approach to thinking about strengthening parenting support at the levels of policy, strategy, and systems and program planning. It offers direct links to evidence, best practices, and implementation experiences worldwide, and includes targeted information about topics such as adolescent parents, disability inclusion, caregiving in humanitarian contexts, care systems and care reform, intersections between violence against women and children, advocacy strategies, and samples of monitoring and evaluation indicators. We have come to think of it as the ABCs of what not to forget when you are strengthening parenting support at the national level. UNICEF's principles of inclusivity, equity, and responsiveness to cultural diversity inform the development of this global framework. The framework maintains a vision of parenting support that is family-centered, strengths-based, gender equitable, and disability inclusive across all settings and stages of childhood. So taken together, the framework's components translate these guiding principles into actionable strategies that aim to contribute to improved child development and well-being. Next slide, please, Martha, and over to you.
Thank you, Jenny. So the framework starts by unpacking these three key dimensions to understand what parenting really means across the life course and the many forces that shape it. First, parenting evolves as children grow, and the needs of caregivers evolve as well. We need to ensure that the guidance that we receive remains relevant and meaningful, and it also means recognizing something we often overlook. Adolescents, especially girls, frequently take on caregiving roles too. And these roles can foster responsibility, yes, but they can also create risks. Second, parenting is made up of a combination of actions, emotions, attitudes, including how caregivers nurture, but also how they take care of themselves and how they reach out for help when they need it. These different behaviors are shaped by their own experiences, by gender norms, by the support available to them, and by the services they can or cannot access many times. Adolescent parents, in particular, they need tailored age and gender-responsive support that protects their rights related to their own development and education, while broader efforts work to prevent early pregnancy and child marriage. And third, caregiving doesn't happen in isolation. Extended families, communities, and informal networks all play vital roles in shaping caregiving practices. When we understand, respect, and strengthen these community systems, we promote supportive environments for both caregivers and children. And with this in mind, understanding that parenting is multidimensional, dynamic, and deeply influenced by time, context, and relationships, we can now explore what the framework is and how it can help us in our work. Over to you, Jenny.
Thanks, Marta. Next slide, please. So we know that parenting does not occur in a vacuum, but rather within a wider network of people and structures and systems. The illustration that you can see here captures how the key components of the Global Parenting Support Framework interact to build a coherent system for parenting support across the life course of a child. Recognizing that the support that families need varies very significantly, so from those who require foundational support to those who require progressively more specialized interventions and support, the framework adopts a universal progressive approach. This approach is represented at the very center of the illustration by the universal progressive parenting support pyramid, the triangle in the middle. Surrounding the pyramid are the 7 core system strengthening building blocks, which together create the infrastructure and the institutional capacity needed to deliver parenting support at scale. Encasing the system is the broader enabling environment, the thin gray strip you can see, which consists of economic and environmental contexts and social and gender norms. These contextual layers influence caregiving behaviors and access to services. So we're going to talk a little bit more about each of these components now. So for those of you who are not familiar with the parenting pyramid, it has 3 levels: the universal right at the bottom in the palest blue, targeted in the middle, and intensive on top. At the base of the pyramid is the universal parenting support, which includes broad population-based initiatives that are designed to reach every caregiver. These aim to strengthen positive norms, to promote nurturing practices, and to prevent violence. This framework further distinguishes 3 main forms of universal support. First is parenting information and community engagement. This form of universal support raises awareness and promotes positive social norms through communication and community-based initiatives. So, for example, raising awareness about activities on available parenting services. Secondly, we have interactive and participatory learning. This is where parents build learning and skills and community and confidence through structured group sessions that are led by trained facilitators, through peer exchange, and digital hybrid courses. So this would include digital platforms and mobile-based parenting programs like chatbots and apps. The third form of universal support is support that is integrated into routine services. This is typically delivered by frontline workers who embed key messages and practices into their regular family interactions. So something like home visits by health workers. For some caregivers, universal support is not going to be enough. So the next level up, targeted parenting support, complements universal support services by addressing specific risks and challenges that are faced by families. This might include those facing social exclusion or poverty, or those living in humanitarian settings. Targeted support typically forms part of secondary prevention strategies, and it aims to respond to circumstances that may affect caregiving capacity. It's typically delivered by trained professionals or community workers through trusted local platforms like family centers or faith-based groups or home visits. Some caregivers may need comprehensive, individualized, and intensive support, which typically involves multiple professionals or services across sectors. This level of parenting support right at the top of the pyramid is designed for families with complex needs, such as those affected by family separation. It is distinct from targeted support because it responds to persistent complex challenges that significantly impact a family's ability to provide nurturing care. This level of support may involve coordinated case management and a family systems approach, and is often highly individualized and tailored to the unique needs and understanding of the family and life context. Slide, please, Marta. So parenting support can only achieve lasting impact when it is embedded within strong systems. Strengthening existing systems by ensuring that caregivers have access to things like quality services and benefit from supportive policies and coordinated sectors creates the conditions for parenting support to really thrive. The framework identifies 7 key pillars that together create an enabling structure for quality, equitable, and sustainable parenting support across diverse settings. Slide, please, Marta, and over to you.
Let me introduce you to the first system strengthening building block, legislation and policies. Strong legal and policy frameworks ensure that parenting is not treated as a temporary initiative or a short-term project, but as a core social function and a public responsibility that every government must uphold. Countries need legislation and policies that recognize parenting support within institutions. This means having clear legal definitions, national strategies or plans, and laws that prohibit corporal punishment and child maltreatment in all settings, including the home. And the global momentum is really promising. 66 countries now ban corporal punishment in all settings. So we have many positive examples to follow here. When we talk about family-friendly policies, like parental leave, access to affordable childcare, protection of breastfeeding rights, and child benefits, we know that when they are designed to be gender transformative and disability inclusive, they reduce stress and create enabling environments for families. And finally, parenting support policies must also be cross-sectoral. Ideally, they should connect health, education, protection, and social services, ensuring that no caregiver is left behind. To support countries with this process, the framework includes practical tools and links to multiple resources, for example, the Family-Friendly Policies Toolkit and the soon-to-be-launched the UNICEF benchmarking tool for universal parenting support. We also need to think about how to coordinate and lead these efforts. Jenny.
Thank you. Yes. So the next building block in system strengthening is leadership and coordination, because when parenting is anchored in a national agenda, it gains both legitimacy and sustainability. So leadership and coordination means making sure that all actors work together instead of operating in silos, which is also central to ensuring that there are efficiencies in the financial and human resources that are allocated to parenting support. The framework provides conceptual guidance around coordination that is inclusive of stakeholders in civil society, in academia, and at the community level. It draws from case studies around the world to provide diverse models of national coordination for parenting support, including formal strategies led by a single ministry, interministerial working groups, integration into existing programs such as conditional cash transfers, and multi-sectoral collaboration with implementing partners. Then if we move on to the third building block, we know that policies and programs work best when they are built on what we know works, when they are adapted to where people live and informed by how families actually experience caregiving. The framework recognizes that delivering impactful parenting support services requires a solid foundation in evidence. This approach ensures that relevant data, scientific research, social and behavioral insights guide the design, delivery, and constant improvement of interventions. Evidence-based interventions refer to interventions that have been rigorously tested, typically through RCTs, and have demonstrated statistically significant positive impacts on parenting practices and related outcomes like child behaviors, mental health. Evidence-based interventions are a very important foundation for scaling parenting support. The framework also recognizes that evidence-informed approaches are needed for innovation, adaptation, and implementation in diverse and under-researched settings. These typically use the best available evidence, which might include monitoring data, social and behavior science, and practitioner and caregiver experiences in order to design or adapt interventions in ways that are contextually relevant and responsive, even if the interventions have not yet undergone formal impact evaluation. The framework provides guidance on how to promote contextual adaptations while maintaining fidelity to the evidence base, ensuring that core proven components are preserved. Slide. Sorry, Marta.
Sorry.
Over to you.
So, there is a link in the presentation, sorry, and I was clicking on them. So this section is really about how parenting support reaches families and who is actually making it happen. The framework reminds us that parenting support is not tied to one sector or to one type of service. Instead, it can be delivered through many different entry points: health, nutrition, early learning, education, social protection, child protection. So countries have a wide range of possibilities for embedding parenting support through routine health visits, home visiting programs, early childhood centers, schools, or even cash transfer programs. And of course, community-based and digital platforms are expanding options even further, especially for families who are hard to reach or living in crisis settings. Think of mobile messaging, parenting apps, or radio programs. These have become essential tools for extending coverage. If there is one key idea to take away, it is integration, building on what already exists instead of creating parallel systems. And then we have the workforce, the human backbone of parenting support. We all know that trained, supported, and motivated professionals make the difference between policy and practice. This includes community facilitators, teachers, health workers, social workers, psychologists, and volunteers too. Really, anyone who interacts with family regularly. The framework emphasizes the importance of continuous training, supportive supervision, and mechanisms to prevent burnout. To guide countries, it brings together tools such as training modules, supervision models, and competency-based guidelines. And we also find country examples from the Philippines, Rwanda, Romania, showing how to integrate parenting into existing delivery systems. Let's continue with the last two building blocks of the system strengthening level. Financing is one of the strongest enablers of sustainable parenting support, and at the same time is one of the biggest gaps. The framework promotes long-term multi-sectoral investments so parenting support can move beyond short-term projects and be sustained at a scale. This means integrating parenting into national budgets and sector plans, but it also offers ideas for innovative financing. It also outlines practical advocacy strategies. For example, one of the strongest arguments is the social return on investment, showing that investing in parenting reduces long-term social costs in violence, health, and education, while improving at the same time child development and caregiver well-being. And the last component is data and monitoring systems. These are essential for tracking progress, ensuring accountability, and guiding continuous improvement. The document highlights the benefits of the use of a theory of change and provides examples of monitoring and evaluation frameworks, including indicators for coverage, quality, and behavioral outcomes. Let's continue with an overview of the enabling environmental factors.
Thank you, Marta. So the last building block of the framework refers to the enabling environment, in recognition of the fact that parenting practices and beliefs are influenced by the environments where families actually live. The framework recognizes that enabling economic and social conditions allow caregivers to actually meet their children's needs. These conditions include things like income security, equitable access to social services, housing, infrastructure, and protection from environmental hazards. They also include ensuring safe and healthy physical environments for families to live in with access to things like clean water, sanitation, and green spaces. Lastly, the framework also integrates guidance on transforming gender and social norms, recognizing that norms around masculinity and femininity, stigma, and community pressures that often influence parenting behaviors. They also influence the division of labor and help-seeking behaviors in ways that may reinforce inequity, isolation, or harmful practices. Evidence shows that parenting programs have the potential to reduce both violence against children and women when they take a gender transformative approach. The framework provides practical references and tools to support this type of work and behavior change strategies to influence caregiving practices. Slide, please, Marta, and back to you, Christine.
Thank you, Jenny, and thank you, Marta, for an excellent introduction to the framework. I think it was really clear the way in which the framework has brought together key insights, principles, and building blocks into a very coherent, actionable, conceptual model relevant to diverse national and local contexts. And I'm sure the audience is all very eager to dig further into it. And just to reiterate that the link is in the chat, and I believe will also be sent to you in an email after the webinar. So we wanted to bring this part of the presentation to a close by reflecting on how you, as the primary users of the framework, can engage with it. For successful implementation, it's really key that countries think about adapting the framework to their national priorities, policies, and delivery systems, developing or refining theories of change that reflect their context and goals, building multi-sectoral coordination mechanisms that connect actors across health, education, protection, social policy, and beyond. Strengthening data systems to monitor progress, learn, and course correct, and ensuring meaningful engagement of caregivers and communities throughout design, delivery, and evaluation. And we believe that by bringing these elements together, the framework will move the field beyond the sets of kind of disconnected interventions in parenting that we sometimes see to support a more comprehensive, equitable, and life course approach to parenting support that invests in families as a cornerstone of human development. And finally, to talk to us a bit more about the potential role and value of the framework and how it can be used at a local level, I'm really delighted to introduce Dr. Amelie McCoy and Lulu Nkobo, who will offer some reflections on the role that they see the framework playing in their work in Thailand and South Africa. So first of all, over to you, Amelie.
Thank you, Christine. The Global Parenting Support Framework is incredibly timely. While there's now over 50 years of international research on parenting programs, it is phenomenal that parenting support has received so much well-deserved attention over the past few years in all regions. Here in Thailand, my colleagues and I have been working to adapt, pilot, evaluate, and scale parenting for lifelong health programs through the public health system, schools, and through other NGOs. However, our aim is not to work on our own within just one or two sectors, nor to promote one particular parenting program. Under the Thai government's Positive Parenting Promotion Center initiative, we are actively partnering with government, academic, UN, and other NGO entities to advocate for a cohesive national parenting strategy and to regularly share information on our efforts so that we can strengthen reach and population coverage of all of our respective programs. The Global Parenting Support Framework provides essential guidance to our collective efforts in Thailand and in at least three ways. First, it plays a vital role in bringing together a vast body of knowledge on parenting, when now more than ever, a shared vision, coherence, and coordination across actors and sectors is essential, whether that is within health, education, social welfare, labor, or justice. Second, the framework places a strong emphasis on evidence-based and evidence-informed parenting support. reminding us at country level that participatory, culturally sensitive, independent, and robust evaluations of all of our interventions should be conducted prior to scaling. Finally, the framework underscores the importance of systems strengthening and sustainability. It reminds us that we need to embed parenting support within existing service delivery platforms, adequately resource and strengthen the capacity of a parenting support workforce, as well as ensure that there are timely referrals and a continuum of care, especially for Thailand's most vulnerable families. So with that, we look forward to fully utilizing this framework within our organization, as well as using it to advocate and coordinate with our many partners. So thank you.
Thank you, Amelie, for those very interesting perspectives and reflections on the potential value of the framework in Thailand. It's very inspiring to hear. And may I also invite Lulu to join us to offer some perspectives from the South African context. Over to you, Lulu.
Thank you so much, Christine. When I'm reflecting on the parenting support framework, I see many things. So some of the things that come up is that it is very holistic in its approach for the South African context in Africa and beyond. Many a times you find that countries do want to respond, families do want to support their children, but then sometimes the know-how is not there. So we see that the parenting support framework will bring about the awareness where all the different spaces, different spheres and different levels are considered by countries like South Africa when they are providing sustainable support to the children. Some of the key elements of the framework that come through is in terms of the policy, where countries like South Africa, we see already now it's working on the white paper on families, which is showing the commitment they have in responding to the needs of families. So where the policy not only works on its own, but then it's also looking at the systematic change, but at the center of that, enabling the practitioners to provide evidence-based programming. Because in the center of it all, it is all about the parents and the families responding in a very positive manner to children. So going forward, we can see the engagement with the parenting support framework, learning out of it, so that all aspects, including the evidence, and out of the evidence, being able to adapt what is done, what we do in the South African context, to be able to provide sustainable support in a very, very long time. Not just in South Africa, I'm thinking about some of the work that we do as an organization. Part of the CSOs is that we are working together, networking, so that we can build a voice on the needs that need to be supported for families. Some countries also, like in Tanzania where we work, we're also seeing some commitments where national parenting policies are merging not just CSOs, families, government is there, researchers are there just to make sure that everything comes together. So we are happy and we look forward to engaging further and launching it in the South African context as we continue to work with the Department of Social Development, other departments, as we are jointly making sure that everything is collaborated accordingly. Thank you so much, and back to you, Christine.
Thank you, Lulu. Again, very inspiring words, and we're really looking forward to seeing how this develops in the South African context following the launch. So thank you for sharing those insights. We have the opportunity now to open into some Q&A for about 10 minutes or so. A couple of questions already in the chat, and please feel free to continue to post your questions as they come up. I'm going to start by asking a question to Jenny and Marta, which I think relates to one of the questions that was posted in the chat. Jenny and Marta, would you share with us a few words about what the framework is not? Having very carefully outlined what it is, could you share with us what it is not? And I think if you can also reflect the there's a question in the chat. Is there an operational document that describes how to build a parenting program? So if you could maybe reflect on what the conceptual framework offers in respect of building a parenting program and where else we might be able to offer to point towards other resources.
Sure. Thank you for your questions. Marta, why don't I take the first half of the question and you take the second half? It's perhaps a clear oversight to not have said clearly what the framework is not. It is not a parenting program. I think that's the clearest answer to the question. It's not a parenting program to be implemented. It would also not help you test a program either. So there are hundreds of programs that are tested with results. This is a broader, more structural way to think about parenting support at these levels of policy, strategies, and planning. So that's probably the clearest response to what it is not. Marta, do you want to pick up on? Thank you.
Marta,
Sorry.
you're on mute. Oh, sorry, you're there. Did you want to sort of repeat the second half of the question?
Could you repeat that, please, Christine?
Yeah, of course. So the question in the chat that relates to this, thinking about what the parenting framework is not, is there an operational document that describes how to build a parenting program? And perhaps you can also reflect a little bit on the tools that are referenced within the framework that provide kind of jumping off points for those using the framework who might want to dig into program design in more detail.
Yeah, of course. The way the framework has been thought is in a way that it serves us as a guide, as a conceptual guide to develop other kind of job, but also as a resource with multiple links and tools that we can use for adapting different programs, for developing programs, to learn about other practices, to learn about the experiences of other countries. So what are we gonna find in the document? We're gonna have these concepts, no, that we have briefly discussed in this presentation, and then we will have these links to other kind of resources, programs for other countries. I think that's the way we can where we can find examples for operationalization. Sorry. I don't know, Jenny, do you want to complete with anything else?
Yeah, I think it's just worth saying that there are very specific links to resources that have been developed by UNICEF and the WHO.
Yeah, absolutely. And
developing...
also, sorry, Jenny.
No, that's okay. Go ahead.
Sorry, I might have cut you off there, but we'll also post in the chat a link to the Global Initiative to Support Parents website, which has a really excellent repository of parenting resources. UNICEF's Global Parenting Hub as well also has a number of resources on building different kinds of parenting programs. So there's quite a lot out there. And the parenting support framework, as we said, really tries to capture lots of these tools and resources and provide signposting and links to other parts of the programming and policy architecture for parenting support. So it's a great jumping off point. Jenny, did you want to add anything? Or
yeah, I just wanted to add one more thing, that not only will the resources you just highlighted be useful in thinking about developing national parenting programs, but the framework also provides examples of national parenting programs that already exist. I'm thinking of the targeted part of the pyramid. There's a whole section on what need or risk are you trying to address, and here's some illustrative examples really from countries around the world. So there are also some case studies that you can draw on in thinking about developing a national parenting program. Thank you for the question.
Thank you, Jenny. There are a few questions coming through in the chat. Before we move to those, could you offer some reflections, perhaps drawing on some of the perspectives that were shared by Amelie and Lulu on how the framework can be used? What kinds of roles can it play at country level with different kinds of stakeholders who can engage with it?
Yes, of course. I mean, I think Amelie and Lulu have showed some really good examples of the practical utility of this tool. The audience, governments and other stakeholders can use it to better coordinate and strengthen the systems that they already have in place to support parents. They can use it to ensure that there are efficiencies in financial and human resources that are allocated to parenting support at the national level, to ensure that their policies and the program planning are comprehensive and inclusive. And also, as we just said, to aid in the selection and vetting process of interventions and programs to support parents. So to consider all the levels of the pyramid. Marta, did you want to add anything?
Okay. And there's a question in the chat about whether or not what role the conceptual framework will play in the Caregiver Forum in Madrid, which perhaps I should take a first crack at, and perhaps to give a bit of an overview about the upcoming Caregiver Forum, which is a really exciting milestone in the work and advocacy that's ongoing across the world to build momentum for universal parenting support, and that will bring together a range of global partners and governments and different stakeholders working on parenting to continue to make the case and build a coalition around this movement. So we expect the parenting support framework to be front and center at the Global Caregiver Forum, and the framework will be presented. It's also been used to structure most of the technical sessions, both in terms of content and what is delivered on the second day and how the audience engages. So we took the framework as the first starting point to define the set of parallel sessions that will take place at the Caregiver Forum. And of course, it is implicitly a consensus-driven framework, which is being launched today by the Global Initiative to Support Parents, as well as UNICEF. And with that in mind, it is also informing the set of outcomes that will come out of the Caregiver Forum and defining the direction through which we want to take the policy and programming architecture for parenting support. So we're really excited to have the opportunity to present the framework next month in Madrid, and look forward to bringing it out to the field again at that point. I don't know if Jenny and Marty, you want to come in any further on that particular question, or we can move to another one. So I guess one more question would be if you can perhaps reflect a little bit on how the kind of life course perspective was integrated into the framework. There was a question in the chat about how this framework is different from the nurturing care framework. So how did you build in the life course approach into the framework? And the other dimension that's very clear and very prominent in the framework is the role that parenting plays to promote gender equality and prevent family violence. So perhaps if you could say a little bit more about how you worked to integrate these two important dimensions into the parenting support framework.
Sure. Why don't I start with the life course, Marta, and then you can pick up with gender. The approach is very similar across both of these domains. So if I start with the life course, it has been meticulously integrated throughout. So you can see examples throughout the framework where there are distinctions between priorities for early, middle, and adolescent children. We also tried to reinforce the life course approach through country level examples and policy and program that cater to these specific stages of childhood. And also through references to resources, the Adolescent Mental Health Hub, UNICEF's Parenting of Adolescents, programming guidance that was relevant to different stages of childhood. And also through information boxes that address these specific topics. So Marta already referenced the adolescents as parents themselves. A lot of the content in our review of the first drafts of this framework brought to our attention that a lot of the content is also applicable throughout the life course of a child. So a lot of the concepts are actually where we were trying to meticulously divide these stages and think about the different priority areas. It was actually common throughout the life course. So we have also tried to make it very clear where that is the case, where that is applied. Marta, do you want to come in and talk a little bit about the gender approach?
Sure. do not forget the question. Also, the difference with the nurturing care framework that has been asked in the chat. The nurturing care framework focuses on early childhood from 0 to 3 years, and it outlines what young children need to thrive: health, nutrition, responsive caregiving, safety, and early learning. It's more related with the contents and with the areas we must not forget for helping children to thrive. And the Global Parenting Support Framework it's focused on parenting. It helps countries to design and scale strong parenting support systems as a whole, thinking on workforce, financing, monitoring, gender norms, multisectoral integration. Talking about gender, how gender transformative approach has been included into the document. I hope you find different ways where this content has been included into the document, not just as a section. It's not just a box talking about gender or masculinities or how to involve men into parenting. It has been mainstream through the whole document with different examples. For example, when we talk about the different dimensions of parenting, and we talk about how adolescent girls are taking care of children and siblings, and how we need to take this into account when we design programs for parents and caregivers. But we also have this component of gender in when we talk about adolescent parents, and in different parts of the documents we can find the SBC strategies to transform these social and gender norms, and what kind of behaviors we need to take into account. But also we have approached the care reform on legislation and how it could be integrated with the efforts that many countries are doing to develop parenting policies. I don't know, Jenny, if I missed something.
No, I think the only other thing is that we also consider the evidence in looking at the intersections between violence against children and women. That the UNICEF's gender transformative briefs outlines the needs of this mainstreamed approach. So we took that approach. Thanks, Marta.
Thanks to you both, and thanks particularly, Marta, for responding to the question on how the nurturing care framework and parenting support framework are complementary, but also how that they're different in terms of the purposes and the levels at which they operate. Both of them also very much based on a partnership and coalition approach, and I think that's been really incredibly helpful to the value of the nurturing care framework to the field, and we sincerely hope that the parenting support framework will offer the same value to the field. I'm just looking at the time and think that we probably don't have very much more opportunity for questions. So I am going to, at this point, hand over to our colleague Sabine Rakoto Malala, who is the Senior Technical Officer from the World Health Organization. Thank you for being here, Sabine, and we're offering the floor to you to bring the session to a close.
Thank you, Christine. Thank you for wonderful work. I mean, huge thanks to UNICEF. As always, you're the shining light, bringing this work forward. Also, thanks to ECDAN for organizing this webinar. Thanks for PLH colleagues, Amelie and Lulu. I always follow your work with so much interest. Just from the WHO perspective, I just want to say two things. We know that today 90 out of 195 countries in the world have a parenting support policy. So that's great, in principle, on paper, it's there. We've been reviewing the Bogota pledges, and we see that the most of the pledges have some form of link to parenting support. And what's really interesting is that it's actually the only area where they're very much talking about scale up. However, they're not really doing scale up yet. So we've bridged one gap. We have the policies. We've bridged the next gap. They're talking about scale. And now the next thing will be that they really start scaling up properly. And I think the examples from Thailand and South Africa, Amelie and Lulu, were great. Hopefully we can start replicating those across other countries. And then the second point from the WHO perspective, and I think, Christine, you said it, and and Martha said it, and Amelie said it, the importance of embedding into existing systems. WHO is really trying to do this through the health sector. Like you, we have three principles: remember, strengthen, and add. So, for example, remember that when a pregnant woman is looking anxious, that she may need support and encouragement. Strengthening, for example, creating new pathways to support follow-up, very personalized messaging, and then adding interventions by, for example, healthcare workers doing home visitation programs. So we're going on this scale-up journey with UNICEF, with IRC, with PLH, with ECDAN, but very much through the health lens. And we really do hope that in 4 or 5 years' time, when we start evaluating the importance of this benchmarking tool, we can say we've actually shifted from policies to practice, to scale. And with that, I want to hand back to you, Christine, and thank you again to all of you for the wonderful work. Over.
Thank you, Sabine, and thank you to all our speakers today. It's been a really exciting journey to go on with you all, and really enjoyed the session today, and I hope you all have too. So please engage with the framework, use it in your work, come back to us with any questions, and look forward to hearing about how the framework is being utilised to scale up parenting support across the world. Thank you, everybody, and goodbye.